Hello, my name is Lynn Saville and I'm the Project Manager for the Hertfordshire Year of Mental Health. I'm delighted to be asked to give you a brief overview of this project and to tell you how you can all get involved now it's underway. It's a year running from July 2015 until July 2016. This is a Health and Wellbeing Board initiative, which is important as the board brings together senior representatives from the NHS, public health, adult and children's services and many others who work together to plan to meet the health needs of the Hertfordshire's population. Jointly, they've prioritised mental health. We all have mental health, like we have physical health. Both can change throughout our lives. Many things can affect a person's mental health, such as exams pressures, poor physical health and bereavement. So the right type of support is needed at these times. Increased investment in mental health is planned both nationally and locally. More effective joint working across our county will help us to ensure better access to treatment and to care and to help us to minimise duplication and waste as these changes happen. The Hertfordshire Year of Mental Health builds on the Mental Health Challenge, which was set up by 7 mental health leading charities and authorities. It recognises that councils have a key role in improving mental health in their communities. It offers practical support and encouragement for them to do this. As part of the Hertfordshire Year of Mental Health, we're asking each of our local councils to appoint a mental health champion, to put mental health firmly at the centre of the plans for services which support well-being, such as housing, parks and gardens, public halls, museums and advocacy services. Nearly 9 in 10 people with mental health problems report being negatively affected by stigma. They talk of the shame and the embarrassment which stops them getting from the help that they need, and this can delay their recovery. We think that this is unfair. So, we're also looking to build on the National Time to Change campaign, which seeks to tackle mental health discrimination and stigma. It highlights the small things that people can do to support someone they know who's experienced a mental health problem, such as having a conversation and showing that you care. Our Hertfordshire version of this pledge allows us to collect details of local people who are prepared to champion mental health, who are committed to build their knowledge and signposting abilities, to understand best practice and to benefit from learning opportunities and to generally upskill. It's also helped us to identify local mental health heroes. These are those people who are willing to share their stories which describe the mental health challenges they've faced, to inspire, to pass on their techniques for coping and recovery, and to show that living full and productive lives is possible. I urge you to read these stories on the Hertfordshire Direct website, to see for yourself how the 5 Wells to Wellbeing provides them with practical skills and habits required to build their emotional resilience and improve their own well-being. Our year also includes a programme of events and activities arranged in monthly themes. These are intended to raise awareness and generate interest, to provide a focus for publicity, to get people to talk and to think about the different aspects of mental health. September's theme was self-help. It featured Hertfordshire's library services reading well books on prescription scheme. This helps us to understand and manage our health and well-being using self-help reading. It's endorsed by health professionals. You just need a library card and you can take out as many books as you'd like. It also featured the HPFT's Wellbeing team and Mind and Mid Hearts Improving Access to Psychological Therapies, or IAPT scheme. Getting access to help and support quickly can stop problems escalating. Now everyone over the age of 16 who is registered with a GP in Hertfordshire can quickly and easily refer themselves. Just into our year, we're seeing opportunities to promote and strengthen our mental health offer. For example, GP awareness of the Books on Prescription scheme was low, and despite IAPT being a highly effective service, it is not being used to its full capacity, so more people could benefit. We're also seeking to encourage all of Hertfordshire's employers to participate in the Hertfordshire Year of Mental Health. Hertfordshire County Council has been leading the way, using a mental health toolkit to review the policies and working practices that are in place and support its staff's mental health and well-being. We also talk to our staff. This is how one of them described they felt whilst in crisis, but without the safety harness. As a result, we're seeking to increase mental health first aid training, to raise awareness of IAPT, and to establish an employee-led mental health support group. It's a year to share our mental health stories. This is Daniel, my youngest son. He recently competed for and was successful in being made head boy. The reason I'm sharing this with you is to explain that early intervention and prevention does work. About 10 years ago, I was called in to meet his primary school teacher, who reported her concern about Daniel's behaviour. He was saying he was rubbish and not willing to try anything new. He was stood at the side of the playground watching others play. He had very low self-esteem. It was a difficult, disturbing and embarrassing conversation, but one in hindsight I'm eternally grateful for, as you've heard the results. So, in summary, we want to use the Hertfordshire Year of Mental Health as a catalyst to encourage the individuals, organisations and bodies of Hertfordshire to care enough and to want to proactively play their part in helping all those living and working in Hertfordshire to achieve their full potential. So remember,